You don't have the family support. A lot of places don't understand found family, you know, and they'll say, who's your next of kin? This happened to me really recently. Someone asked me for my next of kin, and I gave them like my found family nearest friend name, and they said, who's that? Is that your sister? I said, no, it's right. Oh no, we need somebody who's... I said, no, we need to have somebody who's like related to you. Well, they are related to me. So there's one of my female friends, and we have an agreement, I just tell people she's my sister, you know, and things like that, you know, because you have to do that, because it's things like that. So they don't understand why they've got family support. People were either ostracised, or they had to live very itinerant lifestyle, and they lose those connections, because even living in bed sits and stuff and things like that, and you had to move all the time to do that. So they don't have that. They don't understand why a lot of older queer people have health problems, because they couldn't access health services, or they didn't want to access health services. In 1988, I broke my ankle quite badly. I had to go to the hospital with the ankle, and while I'm sitting in this room with this doctor, who was very nice, and he's flicking through my file, and at that time it was still big paper files, and he's just flicking through this file as the nurse is bandaging, I'm doing something to my ankle, and he says, oh, I see you're homosexual. Now, I didn't know that was in my records. It didn't bother me personally. I didn't know that was in my records. Now, he was just saying this as, point of interest. He wasn't saying anything. But, you know, somebody at some point wrote that in my medical records, which is still there. And that's why gay people didn't access health services, any sort of health services. And certainly going to a health service where perhaps it was something sexual, if not trans. So people would live with health problems. I know someone who had a very severe health problem and felt they couldn't access their very, very good works health thing, because if they found out they were gay, then they would just get persecuted at work. And that's only like 15 years ago. You know, they said, no, I'll get driven out of the factory. I said, so what are you going to do? I don't know. I said, but if you go to your private thing, it's a private thing, it's really good, you have to wait. And that was somebody who needed, really, 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 really important medical intervention, and they couldn't do it.